Is everyone hearing this recurring theme of physical therapy by chance? And the importance of it? Well, it just so happens that we have one in the house today. Woohoo! Let's please welcome Dr. Marija Radenovic, PT. Okay.
Not PhD.
Might as well be. Marija is a registered physiotherapist at One Step Ahead Mobility here in Toronto. She specializes in working with individuals with complex neurological conditions, especially those progressive conditions. She's also worked with individuals with muscular dystrophies, including our peeps with FSHD. So without further ado, Marija.
Better lift the mic too, Beth.
I know. Yeah.
You tall people.
Yeah.
Hi, everybody. Can you hear me?
No, a little bit closer.
Okay, is this better?
Yeah.
Kind of. Okay.
Yep.
Is this too loud?
No.
Thank you. I'm gonna touch on that question, just because I think it's a wonderful question. I am kind of here in my capacity where I work part-time in a progressive neurological private physiotherapy clinic. I do some work in a hospital. Hospitals really like patient feedback. And so there's always a department or a place where you can give your 2 cents. It doesn't have to be anything specific, but that's probably your best place for advocacy. If there's something you feel like you want to have seen, there's always a form online, or if you go in person and say, I can't believe there's not a physio in this clinic. If enough people do that, that's kind of how we get some lobby efforts. My goal today is really to talk about some general guidelines. We're hearing a lot about physical activity. We're hearing a lot about we don't actually know. And so you'll see that that will kind of be a running theme. My overarching goal is to give you a sense of what this might look like for you. The approach to exercise and physical activity is going to be a bit different than what you might be used to, or what a physiotherapist community might be used to if they're focusing on really specific, muscle and joint types of pain. And so we're going about this a little bit differently. What we tend to see is that, if it's done well, and if it's pain-free exercise is generally okay for most people, and FSH is definitely in that population. I've split exercise into 4 main categories. Aerobic exercise is exercise we're doing that's really focusing on improving the heart, the arteries, the lung capacity. So we're working on whole body changes. Resistance training is more targeted toward particular muscle groups, particular bone densities. And so we're looking at changing just one part of the body. And then we have things like our flexibility and our balance. And so it's also something we can train. These last 2, so flexibility and balance, tend to be low risk. And so if they're done well, and that's kind of the key part here, if they're done well and they're pain-free, we're really not worried that it's going to cause any sort of damage or further progression of the disease. The same is true for aerobic exercise. So there's some relatively clean research that takes a look at our fatigue, our aerobic capacity. So things like how easily you tire, do you need to nap in the middle of the day? Can you walk the distance that you need to be able to walk? And so we're actually seeing really good outcomes in terms of this is a skill we can train, and I'll touch on this a little bit more and how you might go about that and really fit it into, your particular needs and what you're looking to accomplish. Resistance training is, I think, the big talk of today. It's the nice question mark where there's some really theoretical understanding things and discussions about why it might work. There's a lot of risk and concern. I will say anecdotally, the way that I see it, it's kind of a risk benefit. And so if you're somebody who might have a higher risk tolerance and you hear all of these concerns that we're telling you and you want to try anyways, this is a way we can do it together. We're always monitoring how you're feeling and really, guiding in how things go. So it really needs to be individual, and then it's related to, how risky do you want your therapy to be? It doesn't seem to like progress. Oh, my mic died? It doesn't seem to like increase the progression of the condition. So that's the good news. there's definitely some reasonable concern about what it might be doing when we're doing some resistance training, which by default is causing damage to particular muscles. So when we start with aerobic exercise, the reason this is so important is because it has really important input into our heart and our lungs and our circulation head to toe. And so cardiovascular exercise is a standing recommendation for basically everybody. The goal here is to find a way to do it that's going to be pain-free, that's going to be comfortable. And so really what we're doing here is we're trying to increase our heart rate, increase our breathing rate. You might feel whole body changes. So you might feel a bit warm, you're breathing a bit deeper, you might be getting a little bit sweaty. We're trying to get non-stop movement for 8 to 10 minutes. And so what you do and how you do is actually quite open. Your heart can't tell the difference if you're waving your hands, if you're walking, if you're swimming. From a purely cardiovascular position, we have a lot of choice, meaning that you can pick the kind of aerobic exercise that's going to fit what you can do comfortably. We tend to go on this low to moderate route, so activities that make you feel a whole body change, but it's not so difficult that you can't do it for more than 10 minutes. In here, one of the key features is that you can do a half an hour workout, or you can do 3 10-minute workouts. And from a purely heart perspective, your body can't tell the difference. And so if 30 minutes of a movement might seem unachievable now, you can work on getting 10 minutes of movement and repeating that more often throughout the week. We're aiming for about 60 to 150 minutes. That's a really massive range. 60 is coming from some of the research looking at this population in aerobic exercise and what's feasible. 150 is the recommendation from the Canadian and American kind of health guidelines. Some of our practical tips will be really picking a modality that's going to be gentler on our joints. And so it might be biking, stationary biking, pools. So swimming, aquafit classes, just walking through water can be a consistent, nonstop movement that's going to be gentle, especially if you're having a lot of pain. And so that can be an avenue where,
I'm trying to turn this up a little bit.
that can be an avenue where you're using your body nonstop, we're getting exercise in, and it's feeling a lot more comfortable. If some of you are in the city, there's about 5 or 6 heated pools, so you feel extra good because you're in the warmth and you're moving around. Other places will have similar types of facilities where you're feeling comfortable and you can get exercise in that way. And then if your vocation is walking and that's something you want to do, you can use some of these assistive devices to make that easier. And so we're looking for nonstop movement as many days of the week as you can. When we get into resistance training, there's usually 2 big concerns that we talk about. The first one, outside of the theoretical world, is just an increased risk of injury. And so we know there's a lot of asymmetry in the body. We know that some of these muscles are definitely weaker than their comparison in the other side. And so one of the things I like to do is we're just starting slow and we're building into this routine. And so in this case, we're trying to maintain our muscle mass. We're also trying to utilize any unused space. So the disease itself is causing damage to some parts of the muscle. Some of what you're feeling might also be deconditioning of muscles that were just not being used because we're trying to avoid things. And so when I think about resistance training, my goal is using this unused potential. And that's part of where we're trying to increase our muscle mass as much as we can. We know that in this condition, it's really not our body's ability to build muscle that's affected. And so we can use that as a way to increase how much muscle density we have, how strong those fibers are in kind of this runny course in the background where we're seeing continuous muscle death along the way. One of the other strategies I like to do is I'll mismatch kind of the table up front. So we'll work on different body parts, we'll work on different positions. We might incorporate some of those other types of training, flexibility, balance, and I'm really using how you're responding and the symptoms you're telling me and where you want to get to as a guide for how we're going to introduce aerobic exercise and resistance training into your routine. The other kind of main concern is that there might be some muscles that are overworked. This tends to be a little bit more of the population that might have more severe symptoms and disease progressions. Typically, I'm staying away from doing formal resistance training, kind of areas around the neck or really painful joints, because these are places that are working nonstop. That's not to say I never do this, but kind of globally, my goal is to stay away from things that might aggravate your pain. And then a little bit about kind of physical therapy in my role. Most of what I do is you come in and usually somebody's coming in with a particular goal in mind. And so my job is to kind of make that happen. We're talking about what can we do to optimize what your exercise is looking like? What can we talk about your physical activity in general? So how are you spending your weeks? Where are some places we can put some efforts into improving what you might already be doing? Often I'm working at access issues. So is there a part of the house or an activity that you're having trouble to do? How can we train that activity? How can we find strategies to make it a little bit easier to do? Are there any assistive devices we can add on to make this an improvement? And so this really is driven by the people who come see me. We're working on what is it that you want to get better at. And then usually I'm building some sort of exercise program. And so for you, what does aerobic exercise look like? For you, what might resistance training look like? How do we build a program that's going to be tailored to that? The big part here is a lot of education in ways that you can modify, in feeling more comfortable when you're participating in exercise groups, in the community, at your own gyms. How do we find ways for you to stay active, lifelong? And so my goal is not that people come see me lifelong. I'm really a boot camp. That's kind of how I think of it, in giving education, in working on some ways that you might feel more comfortable exercise. And then you go home, you do that in whatever setting that looks like for you. The other piece here, and I'm just gonna show you some of these assistive devices. It's really starting to build a bit of a network. We've talked today about there not being a cohesive network in Toronto. So I think it's a real shame and a loss that we don't have centers where you can go and speak to a physical therapist, an occupational therapist, a massage therapist, an acupuncturist, a place where you can go to and really try a lot of these. It does end up being a fair amount of trial and error, but this is often where you're going to find what modality is going to be the most helpful for you. So if we're looking at pain management, then you might need somebody who is going to work on more gentle massage, maybe some acupuncture. You try it out, you see if it's going to work for your body. You might have to try 3 or 4 things before you find something that's going to be particularly effective. I do definitely do some work in assistive devices and helping people try what they might feel. So if wobbliness is something you're concerned about, our first aim is to change your body, right? Can we build those skills? Can we build that strength to improve your wobbliness? My next goal is to see what can we give you that's going to make you more confident so that you can walk more often. Might it be a walking aid? Can it be something that's going to stabilize the ankle? What things are difficult to do? So you might think about, something to raise the seat in the car, reachers, binders, braces. There's quite a fair amount of things we can play around with to see if this is going to help your day-to-day life get easier. And that's also part of what this goal is about. And then the last piece is I'm trying to be a connection to other community resources. It's a difficult landscape because it's always changing, but if I hear about, an occupational therapist that works with some FSHD clients, here you go. If you're interested, try them out. Same thing with speech or community resources. And so just trying to build a network in that way. And so that's all I have in for today. This is my contact information. I'm happy to take questions. Super happy to connect with the individual who's talking about exercise and some high intensity piece. I think the goal here is that we just don't have a lot of information. And so we're trying to build the best we can, but we know that exercise and physical activity are going to be really important in maintaining the muscle function as long as we can. Thank you.
Question for Maria. Yes. Can you just speak up since we only have one mic? Okay.
Thank you, Maria. I know we've had the opportunity to discuss before, and you're sitting here. Thank you for that information. This is an unbelievable information session-based conference. I like to say, you know, the common theme that we're seeing here, folks, is no FSHD patient is the same. Everybody is different, okay? And I'm a firm believer too. I work out 5 days a week. I'm a firm believer that you work out in modification. Eccentric exercise have had an adverse effect to muscle wasting in a sense. There's a difference between atrophy and dystrophy. So what's key here is trying to educate the medical profession. You can imagine 45 years ago, trying to tell a neurologist what I had, and nobody knew it. I oftentimes find that I myself explaining to the neurologist, and that's not into the medical industry. I explaining to the neurologist what I have, and you have to go and research. But now things I can see, we're on the cusp of finding hopefully a treatment, a cure. In the last 3 to 5 years, things have definitely changed. Try to find a PT that understands what I have. I know there's different therapists and different exercises I attempt to do. Aquatherapy, I'm doing that currently, which is amazing. You know, you're in the water tank, heated, you know, treadmill within the water tank is amazing. But I've gotten to the point where I used to do leg extensions at 300 pounds. And I pushed myself, and it had an adverse effect on my legs, well, which was muscle wasting. So that's the eccentric part of working out. But it's key, guys. I think it's vital and crucial for us to communicate, to educate what's going on, because we need people in therapy to understand what we have and how to work with it. And you are the only person that knows what you have, and finding a workout balance between, you know, how to find a mean or a medium to say, this is what I have to do to make myself better. And you have to find that balance. I don't think any true medical professional can understand that, except for yourself. Okay, so that's a comment, no question. But,
And I think that's true if you're exercising, you know, on your own, in the community, with any sort of provider. We use what your body's telling us as a guide for how we keep going. And so I think that's the piece where just feeling comfortable and sharing what you're feeling. I also want to add that there is a fair amount of trial and error in this. I don't want you to be afraid of exercise or afraid of working hard. Like, both of those things have wonderful changes to our body, and you might cross the line sometimes, and it tells us where that line is. And so we never want to do that often or without caution, but there's a lot of good value to what we're talking about here, and also a lot of good value to working hard. Thank you.
Any more questions for Maria? Oh, go ahead, Danica.
The recommendation to avoid high intensity exercise, I'm a little confused by that. I don't know if you could talk about like what do you mean by high intensity? Is it like high intensity cardio or high weights or?
A bit of both. When we talk about aerobic exercise, high intensity is something that you can't see yourself doing for more than about 20 minutes. And so let's say you picture your maximum output at the end of 20 minutes, you're so tired that you gotta lie on the ground because that's how much effort you're putting into. We're working at about 50 to 60% of that. And so sometimes we use a rating scale where you're giving an intensity of 0 to 10, 10 being something is so difficult, you could either only do it once, right? It's the most amount of weight you can lift. We're aiming for something between kind of 50%. That is kind of globally what we're working for. It is hard to give a specific intensity because that'll depend on person to person. Generally, you want to see a change in your body when you're talking about aerobic exercise. So you do need to be working enough that you feel like your body's moving, you get warm, you're breathing a bit deeper. When it comes to resistance training, you're feeling some sort of fatigue in the muscle locally. Now, we don't want that to last too far in the future. And so a high intensity might be something that you can only lift a handful of times. The consequence of that might be that in that process, we're changing and destroying some muscle tissue. The way that resistance works in a healthy individual is that our body is then building that muscle back. And so the good news is that that process is not affected when you think about FSH. There's some question about whether it's driving triggers in the background that might in the long run not be as helpful. Yes, yeah.
particularly important to consider your pre-workout routine in
Yeah.
addition to your post-workout routine. If you exercise without the right amount of protein in your body, you will lose muscle. So we've learned a tremendous amount of bodybuilding, how to build muscle, and it's a wonderful.
Yeah, and supplements, creatinine has been a really interesting supplement that the population has started to use as a pre-workout to help our body build muscle. We also talk about things like our fluid intake, how much protein you're having. There are, recommendations for when you eat your carbs before and after, so the science can get quite specific. But we do need to give our body the opportunity and the supplements to then build the muscle. Thank you.
Thank you.